let me turn to you first, Professor Lee. You really don't believe in lockdowns. You think they're pointless. Why?
Well, I think at the very beginning of the epidemic, in March, there were genuine reasons for concern. But I think for several months now, it's been clear that this virus is not the new plague that it was feared that it would be. And yet we've continued to act as if it is that new plague. We've also continued to act in this way despite major harms caused by lockdowns and despite very little evidence that lockdowns, social distancing, masks and all the other things that have been introduced actually work on a societal basis. So we're actually causing more harm, clearly causing more harm, both in terms of deaths and in terms of quality of life by the actions we're taking for a virus, for a disease that's within the envelope of many years within the last 30 years.
And yet, Professor Lee, in this country right now, cases are rising exponentially. So how do you stop the cases rising if you don't have a lockdown? Because the knock-on effect is we get more hospitalisations, more people ICU, more pressures on our health service, and eventually it won't be able to cope.
Well, I mean, my argument is if your health service or any health service isn't up to providing the care that's needed, you should increase capacity. What you shouldn't do is imprison your entire population and do epidemiological and virological experiments on people which don't have any way of being verified, which don't have any evidence to support them, and cause, as I say, cause great harms. There's also a problem that in this phase of the pandemic, people have equated positive tests with cases. Now, this isn't correct. This is simply wrong. In a normal winter, we never obsessively test the population for any virus to the extent to which this virus is being tested for. And the fact is, if you have a positive test but you're not unwell, you cannot be regarded as a case of this disease. You're just somebody who's got a virus. The only people who in a normal winter turn up as cases of this disease are people who are admitted to hospital, people who become seriously ill. And they're a very tiny proportion of the number of positive tests that you would do if you tested everybody. So the fact is that for people under 70, the infection fatality rate for this disease is 0.05%, which is about half of flu. And it's likely to be even lower than that because, of course, we don't truly know what the denominator is because we haven't been testing in the wider population. And many of the tests that have been done, the antibody tests, are the wrong tests to be doing because we should be testing people's T cells, which would show that a lot of people already have pre-existing resistance to this virus. So on very many levels, the approach to this virus, both scientifically and medically, but also in terms of societally, what we're doing with this is simply wrong. My view is that we should have no more lockdown. We should go back to living lives normally. We should travel normally. We should go to work. We should go out. And people who are vulnerable, people who are at risk of disease, the elderly, if they want to, they could be advised to look after themselves. But frankly, if I'm 70 or if I'm 80, I don't want to have many of the things that make life worth living taken away from me by government and government responses that infantilise the population and tell us that we can't make risk assessments for ourselves as we go about our daily lives.
OK, just before I bring in my other guests, I have to come back to you on that bit, Professor Lee, and that would inevitably lead to people losing their lives, people who are vulnerable and people who are elderly. Surely that's not acceptable.
Well, you're saying that nobody should die. I mean, we need to be able to have a grown-up conversation about death in our societies. The fact is, when you get to in your 80s, you have a high chance of dying of all diseases. In the UK, at least, the average age of death is about 82. The average age of death of COVID is a bit older than the average age of death. So the fact is, there's no evidence that COVID is really impacting on the overall lifespan of the population. Yes, certain people are more susceptible to this disease, and it can obviously cause a nasty disease. But the fact is, this societal response is something that has never been done before. There are many diseases that kill millions of people a year. You have tuberculosis, malaria, AIDS, influenza itself, all cause more than 1 million deaths a year. This year we'll have some COVID deaths, which will be more than 1 million worldwide. But the fact is there are 70 million deaths every year, and next year we will have many fewer COVID deaths.
Dan O'Brien, lockdowns we'll be stuck with. Because, I mean, as people say here, we're largely doing it to protect our health service so that it's not under pressure.
Well, I think the government's position has changed. I think back in March it was to protect the health system, and it was warranted at that time because the speed at which cases and deaths were going up was horrific, and we didn't know internationally where it would top out. There was a very famous, now famous medic in this country who predicted 120,000 people dying back in March. Now, nowhere in the world has had that kind of death rate. Absolutely nowhere in the world, thankfully. So now we're in a more difficult situation where the government is saying, as the Taoiseach articulated 48 hours ago, that the strategy now is to wait until we have a safe vaccine. Now, that could be many years, and my fear is that we will get 2 or 3 years out, we still won't have a safe vaccine, the economy will be destroyed, we will have mass unemployment, we will have mass personal bankruptcies, we will have mass business bankruptcies, and the costs of all of that, we get to a point where we still haven't eradicated the virus, and the government goes bankrupt, and we are in an absolute meltdown, catastrophic position where the virus then runs through the population anyway. I'm not saying that's going to happen, but I'm saying that is my fear for what could happen.
But we've already, I suppose, got over 300 people, taking up beds with COVID that are displacing other people simply because of this illness.
We live in a tragic situation, Miriam. There is no good outcome from this. And when something like this arrives, we are going to have tragedies, and of course we need to minimize them. But just in terms of government's focus, it emerged today that government spending in Ireland rose in the early months of the pandemic faster than any other country in the Eurozone. The government is planning to spend more than 100,000 million euro this year. Now, how many contract tracers can you get for 100,000 million euro? How many extra beds can you get for 100,000 million euro? I think the government needs to focus on what it can do and spend less time focusing on telling other people what they can't do.
I think, to be correct, I hope I'm right, that you think it's not just hospital capacity. You want to eliminate this virus.
Well, I agree with much of what's been said, but to try and bring some perspective to this, I think today is one of the single most hopeful and optimistic days that we've had in Ireland in many months, because the first time since July we have taken control of our own situation in this pandemic, and we've had our head in the sand until now. At the same time, lockdowns are awful, and we shouldn't have to be in a second lockdown. And I cannot approve of the government strategy, which is to open up and close down and open up and close down. We can have several lockdowns more before a vaccine comes along, and it may never come along at all.
So are you saying we should just stay locked down for longer than 6 weeks?
I'm saying that what we're doing is not working.
So what would you do?
I think that the government are not equipped to come up with an effective strategy or to implement it. And when we think about who's suffering most now, we often pay respect, rightly, to our healthcare workers, but I think at this point in time we need to be paying a lot of honour and respect to the business community who are going to be suffering very much in this lockdown. But what we really need from them is we need them to contribute to our leadership in this pandemic, both in forming a strategy and in implementing it. And the way to think about this is not to look at the UK or the US, where we've seen evidently high death rates, which we still don't want to experience. We need to reverse engineer the best countries in the world, Australia, Taiwan, South Korea, New Zealand, and we need to apply those lessons to Ireland.
And yet Tomas, comparisons, sorry for cutting across you, are invidious. I mean, I think what's interesting is, do you think we should be longer than 6 weeks at the moment? And if so, how long?
It depends on what the goal is. Philip Nolan's stated goal is 50 to 100 cases a day.
What would your goal be?
My goal would be aggressive suppression towards zero community transmission.
So how many weeks would that be?
Starting from here, we think roughly 10 to 12 weeks.
Wow. Schools open or closed?
If you want to get there faster, it's a fact that this will be faster if schools are closed. If we make the choice to keep schools open, which we do for very, very good reasons, it is going to be a little bit slower.
Close the borders?
I think that we shot ourselves in the foot on borders in summer. If we had kept our borders closed, we would have maintained low transmission for a good amount of time. The crucial way of thinking about...
Can I just ask you one thing about that, Tomas, because someone wrote to me about this. I mean, but what about the 100,000, journeys of trucks that come through Dublin Port alone every year, bringing in vital supplies, making sure we've jobs and exports? What would you do about them?
You manage it. There are many different ways of managing that. If you look at Australia, which is a better example for us than New Zealand, because it's a commonwealth of semi-autonomous states with their own health systems, their own chief health officers, they have land borders with each other, and they have different rates of COVID in different states, and they've managed this. And they've managed this practically by limiting travel across the border, allowing travel across the border for border communities. But the crucial feature is keeping numbers low. And we've had a lot of discussion about how the contact tracing system has evidently fallen apart this week. But that was always going to happen because we had exponentially growing case numbers, but we did not have exponentially growing testing and tracing capacity. The testing and tracing situation really failed in August. That is when we lost control. If you can't stop your numbers going from 20 to 50 or going from 50 to 100 a day, how can you stop them going from 1,000 to 2,000 per day?
Professor John Lee, come back on that and what you've heard from Tomas Ryan there.
Well, we've heard too much of this during this entire pandemic. We hear epidemiologists giving sort of modelling-based suggestions for what we should be doing with our lives. And the fact is they've been conclusively wrong consistently forever, basically, about this. The fact is these simplistic and biologically naive models do not work on a population basis. They do not capture many of the important things in viral spread. These viruses, remember, have been around since the dawn of time. They've actually spread amongst our species since before we were on two legs. The fact is these things can spread whether or not they spread at very low population density. So the fact is, if we're implementing these lockdowns and these other measures, which are hugely disruptive and hugely damaging, the only thing that they may do is slow down the spread of the virus a little bit. But the fact is, in 6 months or a year or 2 years or 3 years or however long it takes, this virus will spread throughout the population and we will be where we're going to end up being. The only difference will be how big of an own goal have we caused in the meantime by the measures which have caused direct harms, which are greater than the virus. I say the only way you can actually maintain a reasoning for doing this is in the belief that this is such a lethal virus that if we don't do it, as we've heard several people say, the number of beds in intensive care and thing will be overwhelmed. The fact is, in the UK, for example, we set up the Nightingale hospitals very quickly in March. Within 4 weeks, there were thousands of extra beds. It's perfectly possible for governments to do this. There is simply no excuse for imprisoning the population. It's simply not fair to young people, it's not fair to anybody under the age of 70, and it's not fair to people over the age of 70, as I say, because it removes many of the things that make life worth living. There's simply no justification for it, in the science or the medicine.
Dan O'Brien.
Well, it's a question about proportionality, and just to put a figure on it, how many young people have died in the Republic? Under 25s, there has been a solitary death from COVID, and we have taken kids out of school. We have ruined the lives of young people just as they're getting to that point of independence and living lives. These are hundreds of millions of people. We've had a solitary death. We really need to ask, how much punishment are we going to put younger people on in particular, force people into mass unemployment, when the risk to those people is so low?
I agree with much of this, but life looks pretty good in Australia right now, and in South Korea they never even had any lockdowns. We have health problems, we have economic problems. The cause of them is a virus. We control this problem by getting the virus numbers low so that our public health doctors can keep them low. And for that, I think we need a private sector mentality with how we execute testing and tracing. We haven't had that. We need to properly resource our public health physicians. And we need leadership from the front, from government. And rolling lockdowns is not acceptable to anyone. So we need to make a decision to have an aggressive suppression campaign that gets us to not always absolute zero, not eradication, but elimination of transmission in the community most of the time.
Could I say that we pick the countries that are closest to us and behaviourally most like us, all of Europe? Why don't we talk about a country like Malta, which is also an island close to Europe? I think, to cherry pick Taiwan, countries around the world, who knows whether their positions will be sustainable? They may find that locking themselves off from the rest of the world will not be sustainable. And in 2 or 3 years, they end up opening up and going through it in a delayed way. So, let's look at the countries around us.
Professor John Lee, I mean, it's a debate, it's a really interesting debate that everyone's having all over the world this at the moment, but people are saying, let's hold out for the vaccine. But you're not so sure that's the panacea at all, sure you're not?
Well, I think it's quite unlikely that we'll have a vaccine that's effective for this virus, or that's effective for very long for this virus. The UK had a Common Cold Institute for 43 years, which was solely tasked with producing vaccine to similar viruses to this one, and it was shut down because they never had a success. The fact is these viruses are very adept at evading our antibodies or evading vaccines that are introduced for them. So that the idea that somehow we're going to have a magic bullet which is going to sort of come riding over the horizon anytime soon and give a get out of jail free card, I think is just wishful thinking. I think governments, I completely agree with one of your speakers, that governments do need to show leadership. I just have a diametrically opposed view to him of what that leadership should be. We are never going to eradicate this virus. I think it's very unlikely that we'll be able to reduce community transmission significantly enough to make a difference without having such punitive measures that they cause far more harm than the actual thing that they're trying to prevent. I come back to the point, at the beginning of this pandemic, people were worried that this was a very severe, very serious virus, a new plague. It isn't. It's quite clear that the infection fatality rate is comparable with flu. You can argue about whether it's a bit more or a bit less, but basically it's not a lot more, even in the vulnerable groups. And in many groups of younger people, it's a lot lower. So the fact is, this is not the new plague. This is a virus, as I say, which is within the envelope of winter deaths that we've dealt with for many years out of the last 30 and for many, many years out of the last 100. We've never done this before. This is a societal experiment, and it's the wrong thing to do.
This is a very dangerous virus, and it could change next year. We can't wait for a vaccine. New testing technologies may make it easier to hunt it out. But right now, a lot of countries in Europe are getting it wrong. But if you look around the world, about 1.4 billion people are living in effectively a zero-COVID situation. Big countries, small countries, democracies, authoritarian states, islands, countries with highly connected land borders. They're all doing it under different circumstances. We need to learn from all of these cases and engineer our own strategy that will work for Ireland, and we need to get it right this time.
Okay, well listen, thank you, all of you. I could listen to this forever, but thank you, Professor John Lee, Thomas Ryan, Associate Professor, and Dan O'Brien. Thanks so much.